Hey everyone, this is Emma. Today is Wednesday, March 4th. And before I jump into a bunch of the latest headlines about the coronavirus and the coronavirus disease, I wanted to let you know the purpose of my recording this video for you right now. I personally have been paying attention to the coronavirus for a while now, since the news started coming out of China, and I pay attention to it every day. I know a lot of people don't have time for that and they haven't been paying attention that long. So as I go through the headlines every day, I'm pulling out some of the ones that I think are the most important, and I'm going to start summarizing them a little bit for you so that you can keep up with all of the news and the information and look into things further if you want to. I believe on any time that we have a topic that is something big that carries a lot of weight for all of us, that it's very important for each of us to do our own research and to come to our own conclusions. So I am not here to tell you what to think about any of these things. I'm just going to tell you what is being said and what is being reported on, and things that are being shared on social media, and I want you to come up to your own conclusions. If you know me well, you probably know that I'm wildly skeptical of mainstream corporate media for a variety of reasons. I think that it's still important, regardless of your sources, to do your own research and to come up to your own conclusions. I'm just here to inform you about what's being said. I am not here to tell you what to think, okay? It's really important to me to kind of get that out there, because I know a lot of people are confused right now. A lot of people are very skeptical right now. And a lot of people are not believing a lot of things right now, and that's for you to decide how you want to feel about any of these things. Most of these stories are actually from yesterday, Tuesday. A few of them are from Monday. I put this article together of some breaking news stories last night, and I'm just getting around to recording a video about it today. This is something that I want to continue doing, and I want to do probably every day or every couple of days, and also record a video about it as long as coronavirus is a thing, and it's something that we need to pay attention to. So I will hopefully get a little bit faster at this, so that the headlines that I'm bringing you are a little bit more recent than yesterday's news. So hopefully there's some stuff in here that you haven't heard yet. If you have heard it, sorry. I will, like I said, try to speed up and do my best to get things to you quickly. First, let me bring you to that article that I mentioned. It is on The Mind Unleashed. It is called COVID-19 Outbreak, 6 Breaking News Stories You Need to Know. So the first thing that I focused on here is what's happening in Seattle. On Monday, March 2nd, we became aware of the second COVID-19 linked death in the United States. By yesterday evening, that total was up to 10 that we know of. So very quickly, the deaths have increased. One very important thing that happened with all of those deaths is that a female in her 80s and a male in his 50s both died in Washington on February 26th. Their deaths were not linked to COVID-19 until yesterday. So their 2 deaths were added retroactively, which is significant, because does that mean that there's more deaths across the country or in Seattle that have happened since the virus has been spreading here that we don't know were linked to the virus? It's something that we should definitely keep an eye out for. And I listed here, according to King County. King County is in Washington, and that's the county that Seattle is in. They've been keeping a list of the various people that have died so far, if they were a resident of that care home called Life Care, and where they were hospitalized. I'm not going to read through that list right now, but you can check out that list if you want to. The most interesting thing here is a person who is not in this list. The sister of a 54-year-old Tacoma man announced his death due to COVID-19 in a Facebook post yesterday. He reportedly passed away on Monday, March 2nd, and like I said, he does not appear to be added into that list. I was sort of expecting to maybe see that death added to the list sometime today, but I have yet to see that. So that's just an interesting side note there. Will that be added? When will it be added? How quickly are they adding deaths? Obviously, I don't know, but that's something for us to keep our eyes on. Also in Washington, an Amazon employee at one of the company's Seattle offices has tested positive for the virus. According to Amazon, the employee went home feeling unwell on Tuesday, February 25th, and has not entered the Amazon offices since that time. This employee worked at Amazon's Brazil building, which is not their biggest headquarters building in Seattle. I don't know how many people are employed at the Brazil building, but like Amazon says, ever since the person went home feeling sick, they have not returned back into the offices. We do know that The coronavirus can be spread when people don't have symptoms, though, so I expect we're going to see a lot more diagnosis and cases coming out of Seattle in the coming days, for sure. The U.S. Department of Homeland Security has closed their Washington offices, according to the DHS secretary, and King County has announced plans to purchase a motel to house coronavirus patients. You're probably aware that as things developed in China, they very quickly made the decision to build a whole entire new hospital. And in addition to that, they also retrofitted some buildings that already existed into hospitals because they needed the space, they needed the beds right away. So far what we're seeing is Seattle, King County having plans to purchase a motel for that purpose. I don't know if they'll retrofit it to be actually a hospital or what it's going to look like, but they've also said that they plan to use modular housing for this purpose as well. Unfortunately, first responders and medical staff in King County and probably the surrounding area are testing positive for the virus. When we first started hearing about what was happening in Seattle, focused on primarily this life care facility that a lot of these people that have passed away were residents of, the video we saw coming out was showing first responders removing some of these people and putting them into an ambulance, but they were wearing masks, but they were not wearing significant protective gear. They had just those thin paper things on. Some of them had gloves. There were some people standing nearby that didn't have masks and didn't have gloves on. So a lot of those people are unfortunately now testing positive. And I believe that most of them are actually under quarantine right now. And for those of us who have been paying attention to this for a while and following the videos and the anecdotal stories that were coming out of China, one thing a lot of us have been waiting for is, are we going to see the same kind of videos and the same kinds of stories happening in other countries that also have outbreaks? And we are now seeing footage coming out of Iran that looks a lot like China did. Specifically, there is some shocking leaked footage that has appeared on Twitter that shows a local morgue in Iran where there are reportedly a lot of deceased victims of the coronavirus outbreak. As of Tuesday, Iranian health officials had announced 2,336 total cases with 77 dead. So on Twitter, there are two versions of this video. One video is just the straight video. The next one has translations on the bottom. So you can play it.
اینجا قصابخونه بهشت معصومه است. دوشنبه 12 این امواتیه که می‌بینید از صبح انجام شده کارشون، ولی متاسفانه
I have heard that since that video was posted, the person who recorded it has been arrested, which is something that happened in China frequently as well, but I do not have the proof or confirmation of that right in front of me. On Tuesday, Iran put its armed forces on alert as the virus continued to spread throughout the country. It has infected and killed members of parliament, which is very significant. There are now 23 COVID-19 cases among Iranian parliament members. The green light has also been given to mobilize 300,000 soldiers and volunteers to help fight the outbreak. On Monday, an advisor to Iran's supreme leader died as a result of being infected with the virus. Moving on to the next topic, WHO has sounded the alarm on the death rate and is recommending China's containment measures. The World Health Organization is now estimating that the COVID-19 death rate is 3.4%, which is significantly higher than previous estimates. People that are following the data and probably people that are not closely following the data might not be trusting the data that is coming out of various countries. It doesn't seem like there's much consistency with how the data is reported and tracked. There is a strong likelihood that some countries might be not being transparent about this information. Here in the United States, there has been a shortage of tests. There have been specific rules and guidelines that you have to meet in order to be tested. And we've recently learned that the virus was probably in Seattle and potentially in other places in the country for 6 weeks before we knew it was. So we have a certain number of people that have been confirmed to be infected with the coronavirus in the United States, as well as a certain number of deaths that have been reported. But we're not testing everybody, so chances are that data is not actually accurate, and like we just saw, some deaths have been added retroactively. So we're not going to get a good picture of what the actual rates of this are until everything is all said and done. The WHO has previously praised China's efforts in dealing with the novel coronavirus and is now recommending the aggressive containment measures. According to a tweet from CBC, WHO has examined the data and believes that the decline in the coronavirus cases in China since the end of last month is real. The agency also says that with similar aggressive containment measures, other countries could also see a decline, like China did. If you've been following the coronavirus situation in China for any length of time, you are probably aware of their aggressive containment measures. There are massive, unprecedented quarantines that have been happening there for over a month now, which is very significant. Some of these places that have been quarantined are larger than New York City. Airports have been closed, public transportation has been shut down, some people have been forced into quarantine, some apartment buildings have been sealed off because of forced quarantine. There's been a lot of videos that have come out of China that have showed things that look like snatch and grab, where the authorities are just grabbing people out of their homes and off the street and forcing them into quarantine. Of course, some of those videos might not be authentic. We have no way of knowing for sure, but there are aggressive containment measures that have been happening in China, and the WHO is now recommending that other countries implement those if they want to see a decline. The WHO has also called on industry leaders and governments to boost the manufacture of protective gear by 40%. According to the UN, some 89 million medical masks, 76 million examination gloves, and 1.6 million goggles will be needed for the COVID-19 response every month while the epidemic lasts. Thus far, the WHO has supplied around 500,000 sets of protective equipment to 47 affected countries, but their supplies are rapidly running out. The U.S. military is reportedly preparing for medical martial law. According to the U.S. Department of Defense, defense leaders have been meeting for the past 6 weeks to make plans on how to respond in the event that the novel coronavirus spreads from the U.S. to China, which we know it now has. We've issued a variety of memoranda and directives advising the force on how to deal with coronavirus. FEMA officials are also preparing for a possible infectious disease emergency declaration, according to documents reviewed by NBC. That declaration would allow FEMA to provide federal assistance and disaster relief funding to both state and local governments to combat the virus. As I mentioned previously, there is a lack of COVID-19 tests in the US, and CDC testing data has vanished. A representative from Wisconsin recently sent a letter to the director of the CDC expressing his concerns about the testing data and how it is no longer being provided to the public. On its website, the CDC had been publicly posting the number of people it had tested for the virus, but that data is no longer there. Below the little graph that says how many people have tested positive is a statement that says, the CDC is no longer reporting the number of persons under investigation that have been tested. The representative pointed out that the CDC successfully keeps track of national health data for a wide range of diseases and should therefore be able to keep track of data related to the novel coronavirus. After a flurry of negative response to the massive cost burden of the test for coronavirus, an administrator for the Centers for Medicare and Medicaid Services said that all costs associated with the test will now be covered by Medicare and Medicaid. Across social media in the last couple of days, there were a few examples of people who said that they needed this test, and they were shocked to find out that it cost over $3,000. One of those stories did say their insurance covered a portion of it, but they were left with a bill of $1,400 for the test. Obviously, if you want to prevent the spread of this virus and you want people to be tested in order to help do that, testing needs to be made widely available and should be affordable, if not free. Those remarks followed a Tuesday announcement indicating that the CDC would revise their guidelines for testing and that any American be tested for coronavirus with no restrictions, subject to a doctor's orders. Prior to that change, it was difficult for people to get a test because they needed to meet a certain criteria to be able to be tested. The FDA Commissioner, Stephen Hahn, has said at the White House on Monday evening that U.S. labs will have enough materials by the end of the week to perform close to 1 million tests, which is good news because we have been struggling in the United States to get tests done at all. They have said that certain labs and a certain number of labs will have the ability to test, but these labs actually haven't been able to yet. There's been a lot of confusion about this. There's been reports that the tests haven't worked. A lot of controversy surrounding this, but there's still more. According to Politico, data provided by the Association of Public Health Laboratories shows that public health labs should be able to run up to 10,000 tests per day by the end of the week. So those numbers don't really match up. The IMF, World Bank, and Google have all canceled events months ahead of time due to the coronavirus. Tech giant Google has canceled one of its biggest annual events. The company has already decided to ban all non-critical business travel, as well as move its annual Cloud Next conference online. So Google has done multiple things now to help prevent the spread of coronavirus. Twitter has told all of its 5,000 employees around the world to begin working from home, and has made working from home mandatory for its employees in Hong Kong, Japan, and South Korea. The IMF and World Bank have both announced that their April meetings will be held in a virtual format due to the outbreak. The spring meeting scheduled for this year in April usually brings some 10,000 government officials, business people, civil society representatives, and journalists from around the world to a tightly packed 2-block area in downtown Washington, D.C. that houses their headquarters. All right, that is the last thing in this update article. Like I said, a lot of these things are from yesterday, Tuesday, as well as Monday. So a few things obviously have happened between now and then, and there's a couple that I will draw your attention to right now. But just like we say right here, look for our next article summarizing the updates, and I will also do a video about that. So I'm not going to delve into any of those things in too much detail right now. I recommend heading over to Telegram if you use that service. If you don't yet, I encourage you to do so. We now have a coronavirus channel there that I wish we would have started previously, but it's a few days old, and we are keeping it updated with everything that happens in the news about the virus. It's a good central location to go to just keep up with everything. If you don't have time to read a lot of stuff, just read some of the headlines. As you can see here, we will put in a headline and then sometimes like a couple of the most important paragraphs. So you can just skim and get a little bit of the news that you need. So I'm going to refresh this and see if there's anything new. Yes, there is. AP is reporting that there are no shutdown orders so far at the epicenter of the COVID-19 outbreak in the U.S., despite having over 9 deaths. California is monitoring over 8,000 people now as the cases continue to soar. The Wuhan seafood market, which is the location that was previously and initially reported as being the ground zero for the outbreak, was closed immediately after, and it looks like now it is being demolished by China, which I've seen plenty of people don't agree with because it seems like it might be covering up evidence, but that is definitely something to keep an eye on and seems pretty significant. A state of emergency has been declared in Los Angeles as 6 new coronavirus cases have been confirmed. Here's more news on the banning of filming or recording the press briefing in the White House. According to Germany's health minister, COVID-19 is now a worldwide pandemic. A lot of people have been saying that that declaration needs to be made, so that is interesting. We'll have to keep an eye on seeing if any other countries follow suit in that. Looks like Netanyahu is also saying that we are in the midst of a pandemic. Iran temporarily freed 54,000 prisoners in an attempt to combat the spread of the virus in crowded jails. So as you can see, this is getting updated constantly. There is a lot of news to keep up with in here, and some of this stuff will end up in my next article and my next video. Show you one more time. This is that update article from yesterday, and I will get to work soon on the next one, and I hope you check it out. Thank you for tuning in and watching this video. I hope you learned a couple of new things. And if you see something that I haven't mentioned, please feel free to let me know. Thanks. Bye.